My name is THEMBI. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative. It's good to be back again. We are here with one other subject that is very important for everyone, be it young or old, and that is nutrition. Nutrition is key in making or breaking your health. But how do you make sure you fall on the side of it making your health? So in our show today, we're going to be looking at that, and welcome.
Hi viewers, my name is Lorica. Welcome back to another exciting topic on the Dr. Alternative show. Thank you.
As I've indicated that nutrition is very important. It doesn't matter what your social status is, what your age is. If you've got it wrong, it will kill you. If you've got it right, it will raise you from the pit. But how do you get it right? What must you do to make sure that it is sorted? Is it your doctor? Is it your dietitian? Is it your medical intuitive? Who do you put your life on the line to make sure that you get the right advice? I have prepared this small clip just to trigger our brain functioning or our brain waves. So let's take a look.
Giving nutritional guidance is a very complex process that requires specialized skill. The body depends on a number of key things for its survival, and nutrition rates top in the list. With all the kinds of food, all kinds of advice, and all the conflicting ideas, how do you know which direction to follow? Even more confusing, what makes certain nutrition programs work, while others fail and are even dangerous for you? Those are questions to look at today.
Welcome back. As you have seen, it is a very complex subject indeed. You do things the way that you have been advised. Sometimes they're sorted, sometimes they're not. You do it your own way. You get the advices from social media because there are so many clips that are floating around that are giving their best shot in advising on nutrition. So who do you go to? Who do you believe? Which one works? So that is where we come in. Now, if you look at how we work or how I work, each individual is unique as far as I'm concerned. And that doesn't come from me. That comes from how God has created us. So even when it comes to nutrition, therefore, it is just as complex and as important to master it as diagnosis is. What I have done, I have selected one case from my existing clientele base, and we'll just have a look to see or to put a mark on what I am pointing out. Let's take a look. Welcome back. We're going to be looking at dissecting this particular person's situation. And as you can see, I'm presenting her under nutritional cases. But Lorica is going to be assisting you with her questioning.
Thank you, THEMBI. And nutrition is a big industry that cuts all ages and status. It is a modern development, in my view. What is your comment on that?
Well, it is. I agree. I agree with you, actually. Because if you look at nutrition the way it was in the past, it was not a big deal. But it was just falling into place. Everything was just working perfectly. People would be healthy. People would be trim. You would not find obese people. I mean, if you go to these countries where they are still observing the old methods of eating, of planting, you will never find an obese person. I promise you. And it is not because they cannot be obese if they were to be given the same kind of food that people are eating in the cities. Because those will make you obese. But it is because they are observing the way God has created food and how it should be. But if you look at how that has been hijacked by the modern society, because food comes from planting. You don't get food from anywhere except meat. But even meat is part of the soil because the ecosystem, the veg, meat, and what. So we're all part of the same system. But that role of a human being to plant their own food has been taken away and has been hijacked by modern society. Modern society says, no, you don't have to have a piece of land where you can plant your own food. I will take that land and I will take that one and that one and that one, and it's all going to belong to me. And I'm going to plant the same food that you're planting, but you're going to buy it from me. And because it rots, because when food is removed from the soil, it rots. It doesn't matter how much you put it in the fridge. You can cool it all you like. It's no longer having a life. Okay. It is only the soil that gives life to food. So now then food rots. So what do? Okay, let me create cold rooms so that the heat, you keep away the heat. But those cold rooms, they've got a shelf life because no matter how hard you try, you're going to find that it's still going to rot. There's still a shelf life. And it loses color. And so you need to put a whole lot of things to make it look good, to give it color, to polish it. I mean, the apples you find, they're so shiny, you wonder, where's this shine coming from? Because naturally they don't shine like, because they shine them. They put, so you do all sorts of things, but all those things are not focusing on your health. They're focusing on preserving this so that you as the buyer, you still find it looks good. But all the nutrition that is supposed to be preserved, you lose it with all those developments. But what brings all of that? That's the modern society. It's the modern society. So we say, the way we used to live is primitive. I was even listening to a clip and I'm like, this boy, I wish I could find that clip and show it to the viewers. Because he said, no, black people are primitive. There he was cunning on about how primitive we are, and don't. And I'm like, because you are what do they call the Jay-Z's? What do they call the 2000 years? Well, I don't know, there's a Gen...
2000.
No, there's a specific, that's Gen Z or whatever, but there's something that they call them. So I agree with you that nutrition or supplementation, let me say supplements, that have been introduced as part of nutrition, which we need, it's an industry that has been created because of the mess up that has occurred, which was deliberate. It was not a mistake that they did this. It's all part of the bigger picture of control and let me make sure you do as I want. So it is a big one. It is a big development, a very bad development because of hijack by the modern society. But it is a necessary thing because now that food has been depleted of the nutrition. So even if you eat, you're eating rubbish. You see? So the body still needs something. So the nutrition, therefore, that has been put together in the compilation or in the manufacturing of those tablets and capsules and whatever, we actually need them. We need them. But it is a necessity that has invented the creation of, and the booming, and it's a booming industry. Supplements are a booming industry. So I agree with you.
Thank you, Thembi. Every person popping in some supplements, how good or bad is this?
Well, it's okay. I don't want to say it's good. Well, it's good where you need that particular. Let me make an example. People with iron deficiency, you will die if you don't supplement that iron. You know, you really will die. In some cases, you find people end up having to have blood transfusion because iron levels have dropped so low. So you need that supplementation in a number of cases. But number one problem is, how do you know which is a good supplement? Because you'll find this is iron, but from here to there, it's different brands of iron. How do you know which brand is good? Even though they write at the back to say, these are the specifications of that particular product. But how good do you know? I mean, how do you know it is a good product? So that's one problem. And there's no control over that. I mean, I went to one of the shops the other day and I was looking for this supplement. And then she was showing me this lady at these big ones, I don't want to mention. And she was showing me a range. And I specifically wanted a particular brand. And they did not have. So she was showing me other brands. And she shows me this one. She said it's actually made by a lady who is doing well, very well. It's a black lady. I'm not sure if it's a black, but it's a lady. And she said she's doing very well. I mean, her products, the comments and the testimonies and whatnot and whatnot. But it was not a good brand. I mean, remember, I'm intuitive. Me, some of these things I pick up intuitively. So I know. So I mean, I was seeing this brand for the first time, but it did not resonate with me. It was not a good brand. So, but now what I'm getting at, if you're not having this ability that I'm having of picking up certain things, picking up the energy of certain things, how are you going to know this one is good, this one is not good? So that's one. So you'll buy and you keep popping and popping. And the problem is when you're popping all that, it's a toxic buildup. So when it's not good and the body is rejecting it, is not processing it, that's another problem. Okay, so that's number one. Number two, how much of that particular product do you know how you should take? Because the supplement, the standard says take once a day. But maybe your levels are so bad that maybe you need 5. I mean, there are cases where you find, this person, I eat healthy and what, and then I find, you're so malnourished. It's not because you're not eating healthy, but because your body is not processing and absorbing that food. So it's like you're not eating. So I want you to take multivitamins. And in these multivitamins, the specific brands that I will recommend you, then I want you to take 10. The brand is, the container is saying take 1 once a day. May I say take 10 once a day? Because your body is so badly depleted, it needs to be picked up fast, you know? And then you find a person, they say, my energy levels are okay, because this is the thing that, when you say I must take 10 and it says 1, is it not going to have some side effects? I say, go take 10. You came to me because you're feeling like this, take 10. And then they take 10 and say, my energy levels have picked up. They don't feel weak or maybe vomiting or what. Instead, they feel, because you're getting the quantities that you're supposed to get in your case. But maybe that one I was going to say take 2 or even take 1. But because I deal with people individually and I'm guided by what the scan tells me about you and also my intuitive abilities, so you find your dosage is different from that one. So that's a good side. So that's the good and the bad side. The good, you need it, or you don't even know when you're not supposed to take it. Because, for instance, I make another example where people say, my doctor said I must buy iron. They go to these companies, they scrape iron chelate. Iron chelate is not for people that have got iron deficiency. It's for people that are iron overloaded. So here you take iron chelate, and now you are actually chelating the iron. You absorb, you are reducing the iron levels. Meanwhile, you need more iron. But you don't know. I mean, there are so many things that, and in some cases, you don't need to take this one. Like, for instance, people that are iron overloaded already. They find, because it's going to be winter. Now, my doctor said I must beef myself up with vitamin C. You cannot take vitamin C when you've got iron overload issues, because it makes you absorb even more iron, which is a problem. And when you've got too much iron, it's corrosive. It damages the liver. It damages all those organs where it's damped, be it the heart, be it joints, be it the pancreas. Wherever it is damped, it messes up. So, and now here you're popping out vitamin C because it's going to be, and which is what's going to happen now that we're going into winter. People are going to be and yet when you've got certain conditions, you are not supposed to take those. But then how do you know? So that's the good and the bad side of it, that we're just blindly going into it. And that measure of yours say, measure, this one is doing very well for me. You can't stay without zinc. So it's just a big mess. It's a big mess. For the purpose of this topic today, I've selected one particular patient where I think you're going to find a very interesting intervention and direction that I take in this particular case, and see why nutrition was very important in her. Let's take a look. Welcome back. So that's the case that I selected. It's very intriguing. It's actually very complex, and I think even the viewers are probably looking forward to hearing how come I saw it as a nutrition case, while the doctors were saying it's a lung cancer. Okay, she's got lung cancer. Me, I'm coming up with my own conclusions.
Thank you, THEMBI. Let's go through your case that you presented. Why did you see a nutrition case? Take us through, please.
Well, firstly, this particular person, I mean, was really anorexic when you look at her. I mean, big ankles and feet. swollen and big knees, but tiny, 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 tiny. And as I've indicated in the presentation, in the thingy, she has been under various doctors. She's still under a dietitian because they're trying to help her pick up weight. She's dying to have a bit of meaty areas in her body. And even worse, these days, people actually go for implants to have big bums. So, people who don't have weight issues, they want to add. So now you can imagine what she's going through, having to look like that. Now, firstly, this person, her report was saying she's got from an oncologist, because she was actually referred to an oncologist because her GP believed that she's got lung cancer. Also, the oncologist did the x-rays. I don't know what other tests, because she doesn't know either, but they did some tests. And here they come and they say lung cancer. So she comes to me, but then she said what they could not answer. Because for someone who's got lung cancer, she's that advanced, because they said it's almost stage 4 because of the big growth under the breast here, more, to the center. So they were saying it's almost stage 4 cancer. Okay. And now the question is, so she's asking, but why am I breathing normally? Because even though here and there I will have a bit of shortness of breath, but as I'm sitting with you guys, since I've been visiting you, I don't have issues, respiratory issues. And why am I not in pain? Because he only prescribed pain medication for her. Why am I not in pain? I don't even have Panado, let alone these big pain tablets that you're giving me. And she said they could not give her the answers. Why? Because for someone who's that advanced in cancer, but who does not even present with smaller kind of symptoms in that direction, it was just frying their brains. So she comes to me, but she's not coming because she's feeling pain. She wants to pick up weight. That's why, not because she was saying I must do anything with cancer. I don't even know if she was believing that it's cancer. She was not even flustered by that. So here she comes to me, and I tell her, no, the condition that you have got is menetrier disease. Menetrier it's the problem of the stomach lining. You see, the stomach has got a lining that protects the stomach from inside, where there's a lot of mucus, and that's what protects the stomach from the acid, because the stomach uses a lot of acid, hydrochloric acid, gastric acid, to digest food. But what makes that acid to not affect the stomach is that protective cover, that stomach lining. And that stomach lining has got a lot of mucus that's full of protein. But now her condition was the menetrier. It causes the swelling up, not because of inflammation. Those the tissues of that stomach, of the lining, they actually bulge out. They become huge, right around the stomach. They become huge. Even this big knot that she was having, it was one of the biggest ones. But it was the bulginess. But now what happens with that is that you lose that mucus. You lose that mucus and you lose protein. That's the other thing. In the presentation, I actually mentioned that she was flabby. If you were to look at it was flabby. Because she was losing protein. So protein is the building block of the body, of the muscles, of the tissues, of the organs. So now when you're losing it like that, you are in trouble, seriously in trouble. So that's why she was having such flab, such loose flab. But now that's not the main problem. The flab is nothing. The main problem is that she's losing that protein. That's why she was losing weight the way she was doing. Now, even though because a person would have said, so what would help then in that case? Would she have to eat a lot of protein to try and make up for that? No, because she's struggling to digest it and she's losing it. So now, in this case, so that is why, for instance, in my case, she would fall a lot under nutrition. Focus on nutrition. Why? Because the protein she needs, but the protein she's losing. So how do you deal with a situation where you need to make sure she's getting protein and she's not losing it? And then, because she's battling to digest it. And so it's topsy-turvy. It's a very complex case that I actually had to deal with. Before I get into the detail of how I dealt with this case, let's go for a break, and when we come back from the break, we will tackle it.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adenylase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat?
Welcome back. We are talking about nutrition and the importance of making sure that you get the right nutrition for your body. When we went for a break, I was about to tell you about why this particular case that I presented to you was a big nutrition case. All right. Firstly, I had to make sure that she's getting protein. The protein that she's battling to keep, that she's losing, and battling to digest. Okay, because her whole digestive system, her stomach is topsy-turvy, upside down. So now the first was to make sure that she does get protein. Okay, but now how does she get protein without losing it? Firstly, I was giving her the plant protein, type of protein that's it's not difficult to digest. Because if you look at animal protein, because most people, when you talk protein, they're thinking you must have lots of red meat, you must have lots of fish, but largely meat. Totally cut animal protein in her case. Totally. And that was the thing that was she was focusing on the advice of her dietitian, even her doctor, that she must have lots of liver, of course liver with iron as well. But she was advised to take a lot of meat portions of food. Like maybe in a day she would have a protein maybe 3 times a day. Whether it's in the form of eggs in the morning, and then lunch with a lot of meat, and then later on maybe she would have some smoothies or whatever, or even another meal with meat. Okay, so me, I would totally cut out animal protein because that stomach is not in a position to digest. And when it is sitting with undigested meat, we're dealing with 2 problems now. Problems of protein that has not been digested properly, in fact, that has not been digested, which therefore forms a toxic build-up. And we are sitting with protein that has been lost. Now she's losing protein, but then she's having a build up of that protein that has not been digested, that therefore ends up forming a toxic buildup. So we don't want to have that. At least let's deal with one problem of her battling to digest protein. Therefore, what I focused on was give her plant protein. But even in plant protein, it was accompanied with a lot of eggs. Eggs are easy to digest. The body can process eggs much better than meat. So she would get eggs in different forms, whether it's in smoothies or it's poached or it's fried in good oils. But she would get lots of eggs. That's one. But secondly, I would build up her capacity, her muscle capacity, because even the stomach tissues and the muscles I would have to work on. I would build up with things like whey. Now, whey carries a lot of a good composition of building up the muscles and the tissues. But you need to know which whey. Because remember, whey is used by the bodybuilders and it's sold in these big containers like this. But how do you know which one is good whey? So that's where I come in, that I would give her the specific type of whey that I know is good, but mix it with a whole lot of things, like raw eggs, like nuts, a whole lot of things. That would give a combination of protein, but in a manner where the body can manage to deal with it without working hard and therefore hold on to it, So then when she started, so that's the one set of nutrition that I would give. I would not give her starch, hard starch like your rice, your beans, even though I would be giving her plant protein, but I would not give her beans, at least at the beginning, because beans are also kind of heavy to deal with, even though it's plant, but they are a difficult type of plant protein to digest, particularly certain type of beans. But sugar beans I don't even look at because they are just bad beans anyway. So I'm talking about other beans like lima beans, the red eye beans, those type of beans. I would look at those, but at a later stage. At the beginning, I would treat her like a baby. Because a baby, the digestive system of a baby can only handle liquids. Okay. But it doesn't mean when you give her liquids, then she's not eating. She's getting enough nutrition according to the capacity of the digestive system at that period. So even with this one, I would give her nutrition that doesn't need to be digested that heavily, okay, but which constitutes a lot of protein content, and therefore is giving her enough without necessarily losing much of it. Okay, so after starting with that, she started picking up a bit of weight, and she was actually excited and she wanted to even take it. I said, don't use a scale because the scale is only going to show, maybe might not even show that there's an improvement. You'll just be frustrating yourself. But she started feeling it. Okay. But then I was giving her supplements as well. I gave her multivite because, like I'm saying, she was eating lots of meat and all that, but she was totally malnourished. So it's one of those cases where I gave her 10 multivitamin to assist with the malnutrition, with the nutrition. I would also give her zinc, okay, I would give vitamin E, because all those, they are actually assisting even in the digestion, because zinc improves your thyroxine levels. That helps with metabolic processes, natural metabolic process, even selenium. So I started giving a certain type of supplements that are not just dumping. They would be specific for her condition. Okay. So, and then I would, even though there is a whole lot of other things that I would use in her case, which I won't get largely into now. Like, for instance, might be the question might be, why would the oncologist see lungs as being affected, you know? And why would she also have the swelling of the feet? Okay, how does it connect to this condition? Now, if you look at this disease, like I've said, that you lose the mucus that is in your stomach. That's liquid. That's thick liquid, but it's liquid. So what happens? Because of gravity pulls everything down. So that's why you'll find in most cases they will have swelling up on the feet. But then the respiratory system, you find it tends to be, it doesn't mean with every person who's got menetrier, they will have respiratory issues. But it is consistent with the respiratory, with the menetrier, that it would be, she actually ended up with respiratory issues. Even this bulge, because remember, with the oncologists, they're saying, this is a tumor. It's a growth, but it's not a cancerous growth. It's not a cancerous tumor. It's actually a stomach tissue that has bulged out, that has become so big. And it was not just only, it was actually going right round, but it's just that it was bigger here. Okay. But it's not in the lung. It's in the stomach. And these are the things that I find. I was talking to someone, I can't even remember, the other day, and I'm saying, I'm curious to know that these machines that they use, like, for instance, radiography, radiologists, when they put you on the ultrasound or whatever other equipment they use, when it shows a growth or a shade in a particular area, does it give specifics of that growth? That the properties of that growth, it's the clot, or it is a calcium crystal, or it is lipoma? Does it give, or does it just show that there is a bulge or there's a shade that is located in a particular area? I suspect I have yet to find out. But from my experience of working with different people who come with reports, I am of the opinion that it does not give the specifics of the particular growth that it will show. That is why they do biopsy. Because with the biopsy, they actually remove that, they cut a piece and they analyze the piece. It's only when they've cut the piece that they say, it is. But if you may be not an experienced pathologist, you might not know that this is a growth part and it is located here, and what could it mean? Then you would give it. So I vouch, there's a lot of guesswork that goes with even a particular thing that has already been identified. Because with this particular one, this is a menetrier. This is a bulging stomach lining tissue that has bulged out, and it's not just only, it's taking right round, the right side. But it's not in the lungs. for goodness sake. It's not in the lungs. And which is why she was saying, but why am I not having pain? Why am I breathing normally? Why am I not on oxygen? Or even sitting with, even if I'm not using it every day, but a nebulizer, that's because why am I not having that? While I am on advanced stage of lung cancer. Because that is not what it is. It's this nutrient. So it's a nutrition problem. You're losing protein which you need for every part of the development. That all your organs, all your systems, they need that protein. It's the building block. And you'll find that people with menetrier, even when they get a wound, it takes forever to heal because they're not having that protein that is actually helping to repair that. So that's why I would put it under nutrition. But now, like I'm saying, even when you do that, you still have to make sure you master protocols because you give protein, what type and at what stage do you move on? Because even in the case of a baby, you will find a baby will be on milk. But once the baby reaches a certain milestone, you need to up to solids. Start giving solids. So you can't be giving milk when the body is saying, I'm ready. So that's what I'm actually doing. I was actually doing in a case. And she started picking up weight. Even though I had not even started with meat, I had just put her on this, but she was just dancing between eggs and, not even fish. Fish was not even introduced yet. But when I started introducing solid animal protein, I introduced fish. Okay. Still, I did not start with, I introduced fish, and then I started small with a little bit of rice because you still need those things, So, and then the first time I introduced, she had a lot of discomfort. The comfort that she was experiencing throughout. When I started introducing fish, I did not introduce rice immediately. I started with just fish. And then she started having a lot of discomfort because that body is now, I'm saying, no, you've been having a little time. You're no longer a 3-month-old baby now. You need to start, now you're 6 months. Now you need to start with your solids.
Solid food, yeah.
So, and that stomach, but then it was just a matter of, because I introduced fish and then I stopped. Then I introduced again. And then when I introduced the second time, there was no discomfort because the body had learned to adapt to that. And then I started introducing starch like rice. Then I started porridge. I started with morning porridge, like oats, and pro-neutral and those type of. So, and that's how I started. But even at that, there was still a lot of discomfort. But I chopped and changed the supplements. At some point, I gave her the iron. At some point, when I started introducing meat, I only introduced ox liver. I did not give her meat. Even up to now, I have not introduced her back to meat. The only meat that I would make her take would only be the ox liver. Also because of iron, but also because I'm training her on animal protein. But animal protein, which is not necessarily good for all of us, but even more so in a case. But with her, the reason why animal protein would also work a little bit just to kickstart that, because it gives that heme iron, but then it's jump starting because that digestive system has got to start working. So I had to jump start that stomach, but then in the medication, I gave her a stuff that would shrink the bulginess of the tissues, and then I would give her stuff that would actually mend, like your leaky gut, that would mend those cracks, that leakage, so that there is no leakage. But then I would also give stuff like licorice, which helps in the formation, in the production of the mucus. So while you're blocking the loss of the mucus, you're also encouraging the production of that mucus, and you're making sure that she's getting protein. She's not losing it because you close the cracks. She's producing a little bit more mucus, and you're introducing protein. So with that combination, she really started picking up weight. She started picking up weight. She started even though she was, of course, it was not like a but those cheeks that were like, they started filling up, and she started looking, and also we had to drain the accumulation or the edema on the lung, on the thing, on the feet, but also in the respiratory system. But now what was tricky with the respiratory system was that the mucus is thick. Remember, it's not just runny blood or it's runny fluid. It's thick. So now you need to break that mucus. And because it ended up creating phlegm and making her become phlegmy, So I had to break that phlegm and make sure I break it, and then we kind of eliminate it, but the focus was on the nutritional side, because if we don't get that right and we don't get that protein supplied and she's not losing it, she's toast. I promise you, because even the formation of the blood cells, you need protein for that. So there was no way you would succeed in fixing amenorrheic disease without giving more than 60% focus on nutrition and playing with it. Like, when you're trying to balance it. So that's what I was doing in there. So that's why, therefore, so I've selected this particular case because she came with a diagnosis that said lung cancer, because she had a growth, but with no symptoms that were consistent with lung cancer, the loss of weight and all that. So it was actually a wrong diagnosis. Like I had said in the previous show, and I said, it's actually worse to sit with a wrong diagnosis than to have no diagnosis. Because if you don't have a diagnosis, you're not. But when you've got a wrong diagnosis and you're given, because for instance, she was just fortunate that this oncologist said, no, I won't give you chemo. And she said she would not have taken it anyway. And I'm saying, if you were, it's just that because you were counting on me, but if you are someone who doesn't know me and who doesn't have maybe that much faith in me, and you're scared to death, and you're shaking when they say you've got advanced stage of cancer, and you go for chemo, that chemo would have killed you. That chemo would have killed her fast, because her body is so malnourished with all the protein that she's losing. And now this weak body is now pumped with this chemo. She would have, I promise you, that the first dose of chemo would have killed her. So therefore, when the diagnosis is wrong, you're actually more disadvantaged, particularly if your doctor is going to go with that diagnosis to decide what treatment to give you, because that treatment is actually messing you up. It's better when it's just pain management. Of course, you're just going to deal with side effects of pain management. But when they give you something extra on the basis of this, like this chemo, for instance, if they would give you a chemo, that would finish her up. Meanwhile, she's sitting with something that is totally different. So what I'm getting at, therefore, is that nutrition is a big one, Lorica. Nutrition is a big one, even to viewers, because you need nutrition for that body to function, for that body to develop, to do every system to function. You need nutrition. So when you've got it wrong, bad news. Yes. Bad news. So food is your medicine. but you've got to know what food. And you've got to know, like, for instance, even this thing of fructose intolerance. People are still shocked till today that there are people who are not supposed to have fruit. And if you have fruit while you are intolerant, it will kill you. So you need to be guided by someone who knows what supplements to take, what food to take. Otherwise, I promise you, you are toast. That's where we end our show today. I hope I've clarified a few things, or maybe I've confused you even more. But if you need answers, if you've got questions, you can send them to our Facebook page, as you can see it, or you can send the emails, or you can phone us. We will be more than happy to answer you, even if we don't do it individually, maybe in the form of a show. But thank you for watching, and goodbye.
Thank you, viewers, for watching. I hope you did learn about nutritional supplements. And believe me, THEMBI did nail it. Thank you.